I will send an all instructions detailed. And things we will shortly we will receive. Today we are having webinar now. We are having the particular work. So tomorrow, mostly in the evening, we will get more information.
So the link mic cut mic.
So you both of them in the same room, then,
వారు పోస్టర్స్ எல்லாத்துக்கெல்லாம் என்னோட அன்மியூட்ல நான் மியூட் பண்ணணுமா? அதான் இப்போ நீங்க எடுத்து விட்டதனால வந்திருக்கு.
JP sir.
சார் చెప్పండి సార్.
I connected through mobile as well as laptop. Sorry, desktop.
That's what I got too.
Okay. Because you know now power will go here.
Okay, sir.
Why? Already that's why safe side I kept that and this. Four I will use there.
Because I gave all the four. Big headache is it will go. One second it will be. Okay, for discussion also you go return that. So lot of years go. Just in 5 years, lot more. From the tree to party. All I given. More under the on another.
Sir, principal sir. Sir.
சார் மியூட்ல இருக்கு.
Sir, principal sir.
Jayaprakash sir.
Yes, sir.
Yes sir, I am ready sir.
Good morning, sir.
Nirmal?
Yes, sir.
Yes,
Hi.
yes.
Good morning,
So our
sir.
principal sir is in line.
Yeah, I am seeing him.
Okay.
How are you, sir?
Hello, Dr. Nirmal. Welcome to MNR College of Pharmacy's webinar.
Thank you, sir. I heard about you a lot from Murli. He's
Okay.
my batchmate during my
Who is that sir?
Murli Kumar. He's my
Okay.
batch.
Okay.
Nirmal?
Yeah. Hello, sir.
Yes. First you can come into switch on your videos. After introduction, you can switch off your videos.
Yeah, sure.
During your presentations, you can.
Yeah, yeah, sure.
Principal sir, can we start, sir? Sir, unmute பண்ணுங்க. Sir, you can unmute yourself and you can talk, sir. Principal sir?
I think.
Am I audible, sir? JP sir, am I audible?
Yeah, yeah, yeah. We can hear you.
Principal sir? Principal sir, am I audible?
I think his video got stuck.
இப்போ நான் அன்மியூட் பண்ணனா வந்து திரும்ப நீங்க பண்ணாத பண்ண முடியுமா? இல்ல இப்போ நான் மியூட் பண்ணனா மியூட் பண்ணி பண்ணிக்கலாம்.
Is everything okay, JP?
It's okay. Just waiting for principal, sir. Once start come, you can.
It's okay. It's okay. Take your time.
2 minutes. 2 minutes.
It's okay. Yeah. JP, are you using phone? He's taking the laptop.
திரும்ப மியூட் தாங்க வருது. Start mute. Principal sir, can we start, sir? Okay, sir.
Hello.
Hello. Yeah. Hello, sir. Good morning.
Good morning, sir. So good morning, all the participants and today's speaker, Dr. Nirmal Rajasekaran.
Thank you, sir.
And this is the sixth webinar we are organizing in this lockdown period. And all the webinars are going on well with the support of all the participants. And in this juncture, we thank our management chairman Sri M.N. Raju Garu and our vice chairman Sri Ravi Verma Garu, who are always encouraging us to do such activities. The topic what we have chosen is one of the best one, maybe especially this lockdown period is going on throughout the world. The topic how to tackle this virus-mediated disease. It is the topic of the need of the hour in this time. So let us all listen to Dr. Nirmal Rajasekaran and his experience, how we can tackle the virus-mediated diseases. So with these few words, I request Dr. Saravanan to proceed further. Dr. Saravanan, you can proceed further.
Thank you, sir. So on behalf of the MNR College of Pharmacy, I wholeheartedly welcome all the delegates for the 6th International Webinar on siRNA Therapeutic Potential and Prospects in Tackling Virus-Mediated Diseases by Dr. Nirmal Rajasekaran, organized by MNR College of Pharmacy. I am very delighted to introduce MNR College of Pharmacy to the gatherings. MNR College of Pharmacy is established in the year 2004 and it is approved by AICTE and PCA. MNR College of Pharmacy is affiliated to Osmania University, Hyderabad, and we are offering courses like B Pharmacy, Pharm D, M Pharm, Pharm D, PB. And in MNR College of Pharmacy, we have state-of-art pharmaceutical laboratories, and we have a libraries with more than 10,000 volumes of specialized books. And we have subscriptions for various national and international journals, and also we are offering digital library facilities to our faculty members and students. More than 50 faculty members are working in MNR College of Pharmacy, among them 20 are with Ph.D. The faculty members as well as the student teams are led by our principal, Dr. V. Alagarsamy sir, who is a recipient of Young Scientist Award from DST India, and he published many reputed books. Among that, the most important one and the well-known is Textbook of Medicinal Chemistry. And he is the editor of a well-known Bentham Science journal, Anti-Infective Agents. Along with the curricular activities in MNR College of Pharmacy, we are also encouraging the students to participate in various co-curricular activities, such as participating in conferences, guest lectures, and industrial visits. And we are also encouraging our students to participate in extracurricular activities, such as cultural and sport activities also. And in MNR College of Pharmacy, we are taking special initiatives for university rank coaching, placement facilities, and career counseling. And we are guiding our students for foreign university admissions, as well as we are coaching for higher studies also. And our chairman, sir, Sri M.N. Raju Garu, always tell that education and disciplines are the two eyes. So hence, in the MNR College of Pharmacy, we are providing a favorable environment for studies, and we are taking each and every student individually. And we are offering an education with a less cost. So with this small introduction about MNR College of Pharmacy, now I am very happy to introduce the today's speaker to the gatherings. Dr. Nirmal Rajasekaran, so who is a life member of Tamil Nadu Pharmacy Council, who is having around 12 years of teaching and research experience. He completed his B Pharmacy in the year 2005 in Tamil Nadu Dr. MGR Medical University, Chennai. In the year 2008, he completed his M Pharmacy in the specialization of pharmaceutical chemistry in the same Tamil Nadu Dr. MGR Medical University, Chennai. In the year 2017, he completed his Ph.D. in pharmacy in Seoul National University, Seoul. His areas of research interest is deciphering the cellular response towards exogenous and endogenous signal and active compounds by application of cellular biochemistry in preclinical studies. He is a peer reviewer of many national and international journals, and he got an 3 awards: highest GPA award, best poster award, and best oral presentation award. He is having 2 patents for his credit, and he is also published on more than 20 well-known national and international publications. He also presented on more than 10 papers in many international conferences. He attended around 30 workshops and training, and he is an examiner for PG and PhD in many reputed universities in India as well as abroad. He started his career in the year 2008 in the Balaji Institute of Pharmacy, Warangal, as a lecturer. Later, after completion of his PhD, he worked as a principal researcher in Abian in the year 2017, and the year 2018 he worked as a principal researcher in Enhanced Bio Inc. And after that onwards, he was associated with the Seoul National University, Seoul. And currently, the Dr. Nirmal Rajasekaran is a research assistant professor in the Biotechnology Center, Seoul National University, Seoul. So with these brief introductions, now I am requesting Dr. Nirmal Rajasekaran to take care of these sessions. Nirmal Rajasekaran, sir, please, sir. Now the stage is yours.
Thank you, sir. Thank you, Dr. Saronan, sir, for your kind introduction. And with this, I would like to start my presentation here. Just give me a moment. Yeah. So, very good morning, everyone, and I'm excited to meet you all here through this live webinar. I would like to thank Principal Alagarsamy sir and the organizing committee members for giving me this opportunity. Today, I'm going to talk about siRNA therapeutic potentials and prospects in tackling virus-mediated diseases. Before starting my presentation, I just would like to give an outline of my today's presentation. So at first, I would like to start about what is RNA interference and what are all the RNA therapeutics are in the clinics. Then I'm particularly focusing on siRNA therapeutics and from discovery to FDA approval and why siRNA therapeutics are in need. And then how to deliver these siRNA therapeutics by talking about the drug delivery system criteria of siRNA therapeutics. And with that, I'm going to discuss more about human papilloma virus mediated cancer because virus mediated diseases are a classic model for siRNA therapeutics. Yeah. And then I also would like to show some of my interesting in vitro in vivo data. And at present, we are preparing for the clinical study. So from bench to clinical study, how we are taking. And then for later on, finally, I'm going to talk about siRNA therapeutics, how it can be used for other virus-mediated diseases. Especially today, I'm going to give a short summary of about coronavirus during this pandemic period. So RNA interference is the biological process that regulates gene expression by sequence-specific gene silencing at post-transcription level, preventing the translation of its mRNA transcript into protein. You can simply assume this RNA interference, which bind with this siRNA bind with the target mRNA and prevents its translation so that it also degrades the target protein. So RNA-based therapeutics are relatively new classes of drugs based on RNA sequence. In general, there are 3 main classes of RNA therapeutics are in clinics. One is siRNA, RNA aptamers, and ribosomes. So today I'm going to focus on siRNA here. Is nothing but small interfering RNA. Unlike mRNA, siRNAs typically exist in duplex prior to processing. So siRNA is the double-strand RNA of approximately 21 to 23 nucleotide base pair in length, with the characteristics 2 nucleotide overhang at each 3' end. The enzyme called dicer then cleaves the stem loop. Here you can see the off circle, which called a stem loop joining of the two strands, thereby allowing the two strands to separate, which leads to thermodynamically stable sequence is then recruited to the RNA induced silencing complex is nothing but a RISC. In a short form, we call RISC. This RISC is guided by the loaded siRNA strand, which imperfectly binds to complementary sites, uh, commonly found in target mRNA, which leads to degradation of the transcript. Therefore, it selectively silences the gene expression. Next, I'm just want to give you about the short summary from discovery, how it reaches how it got the first ever FDA approval drug, which is patisiran. So in the year of 1990, the plant scientist Richard Jorgensen and his colleagues surprisingly observed the gene silencing phenomena in petunias, followed by in the year of 1998, Fire and Milo were the first to report the double-strand RNA can trigger uh, gene silencing of complementary mRNA sequence in C. elegans. So in later on in the year of 2006, they they awarded the Nobel Prize for their discovery of this RNAi. So if you see from 1998 to 2018, it's almost 2 decades it takes from the discovery of RNAi to it reaches the first ever FDA approval. siRNA therapy is commercially available now, called patisiran, for the treatment of polyneuropathy in people with hereditary ATTR amyloidosis. So why it takes that so long, and why the researchers are still showing for the 2 decades to develop this siRNA therapeutics? This siRNA therapeutics has a huge advantage. Theoretically, it can treat any diseases caused by gene dysregulation, so that this siRNA silences the target gene, silences the target gene, and as well it's more specific and than any conventional drug that have several off-target effects. And another one advantage is which is the strong option for those undruggable of small molecule and antibody drugs. So it can be the replacement treatment strategy for any undruggable diseases. So there is some advantages as well that causes there is a lots of delay in the development. These siRNAs are basically anionic in nature and large in size, that causes reduced cellular uptake. And also in a systemic circulation, these NAGD siRNAs are degraded rapidly by serum nuclease and phagocyte uptake, which causes very short life in the systemic circulation, also leads to limited bioavailability. It also has some toxic effect. Because of immunogenicity, it activates TLR and interferon responses, and also shows some off-target effect. So this siRNA requires, because of this unstable nature in the systemic circulation, siRNA requires specific vehicles that could facilitate its intracellular uptake and cytosolic delivery for bioactivity. Apart from that, these delivery systems should circumvent all barriers faced by NEGD siRNA, which includes nuclease, renal filtration, and as well mononuclear phagocyte systems. This hence the ideal delivery system, as I mentioned here, this ideal delivery system, which got the nagged siRNA from enzymatic degradation and also helps to prevent the human system response, and then it helps to enhance the cellular uptake. And then once again, you're okay, and also increases the endosomal escape. Many researchers papers deals with the new strategy for this to design and develop an effective siRNA delivery system by chemically modifying the siRNA. For the first method is like you can simply modify the siRNA with different chemical modification, which helps to prevent the degradation, and as well you can deliver this siRNA by using lipid-based targeting molecules, and also some of the lipid nanoparticle and polymer-based nanoparticle, and very recently these siRNA drugs are delivering by using viral vectors. Some of you may attend the very first live webinar here organized by MNR College. So by Dr. Murli, he presented very well about the nanoparticle system, how it works. So basically, if he wants to prevent any drugs from the degradation, or if he wants to enhance the delivery of any drugs, simply the only option is like going for the development of nanoparticles. So the same technique here we apply for the delivery of siRNA by using different techniques. So here I have listed a few of siRNA therapeutics which are in clinics, including those who recently got the FDA approval. As I mentioned before, the first ever FDA approval got in the year of 2018, the drug name called patisiran, which is a siRNA lipid nanoparticle formulation. Within a short period of time, it takes another 4 months to get the next drug called Givlari. It's also for the it's also by Alnylam. So these two drugs, it's approved at present, and there are many siRNA therapeutic. There are many researchers conducting conducting many research for the development of siRNA therapeutics for the treatment of cardiometabolic, endocrinological diseases, infection diseases, cancers, and etc. Today, since my topic is virus-mediated infectious diseases, so here I have also listed siRNA therapeutics which are in clinics for the treatment of virus-mediated diseases like hepatitis B virus and respiratory virus and Ebola virus. Some of them are still continuing, and some of the study is already they have terminated because of its side effects. In this slide, I just want to show from the discovery how it reaches now. If you see from the discovery, I just want to say like there are two phase of this siRNA. Initially, from the discovery, many companies show their interest to develop siRNA drugs, but they because of their early clinical study results, it got failed, so that many of the big pharma company they dropped their clinical trial. And then from 2008, many small company specialized in the development of siRNA therapeutics, they have taken up, and they are showing their interest continuously to develop many siRNA drugs for the treatment of many diseases. So if you see before 2008, after 2008, the number of research and number of clinical trials are rapidly growing. So with this, with the short summary, I just wants to move my research. So I would like to discuss one of my research focused on the development of siRNA therapeutics against human papillomavirus associated cancer. Cervical cancer is the fourth most common cancer in women worldwide. And in 2008, approximately 0.57 million cases were reported and 0.311 deaths were reported, out of which 85% of deaths occurred in low and middle income countries because of their limited diagnostic tests are available. In last 20 years, the incidence of cervical cancers has doubled. And if you see again the future, another 20 years, the incidence and the deaths are rapidly growing. So, and over 99% of cervical cancer is caused due to HPV infection. So what is HPV infection? How it causes cancer? HPV mediated infection. HPV is nothing but human papilloma virus. This human papilloma virus infects and invades the cervical epithelium and infects the basal layer. In the infected cell, you can see the circular HPV genomes it showed in the red color. The circular HPV genome shuttle into the nucleus of the cells, and the viral HPV DNA replicates. So let me briefly talk about what is human papillomavirus and its role in cervical cancer. Human papillomavirus are double-strand DNA virus. There are more than 100 types of human papillomavirus are reported, in which at least 13 of them are known to be oncogenic, and up to 70% of cervical cancer caused by 16 type and 16 and 18 type. Not only cervical cancer, and this HPV 16 type also causes more than 70% of head and neck cancer. As I mentioned before, once HPV infects the normal cell, this virus encodes its own protein, out of which this E6, E7 protein interferes with one of the main signaling pathway in which is P53 RBETF signaling, which are crucial for normal cell functions like proliferation and apoptosis. So during my doctoral studies, I am extensively working for the development of siRNA drug targeting these two E6, E7 oncogene. So I have developed a single sequence which targets both this E6, E7 oncogene, so that we named it 2-in-1 E6, E7 siRNA, which simultaneously target this both E6 and E7 oncogene and reduces this mRNA level. One second. Yeah, I just want to show this slide first. This HPV DNA viruses, once it infects, sorry, this E6 E7 interferes with the P53 and RBETF signaling and degrades through proteasomal degradation, which causes cancer cell, which causes normal cell into cancer cell. When my 2-in-1 siRNA, which simultaneously target this both E6 E7 siRNA and degrades it, which restores this P53 and RBETF signaling in the cancer cell, which causes cell death. So this I want to show with you before about how this siRNA works. Sorry for the confusion. Based on GOG, that is gynecology group, 120 GOG 120 study reported that CCRT with the low dose of cisplatin has the survival rate of only about 14 to 33% in patients beyond stage 1B. So if the patient reaches beyond stage 2B, or the patient with the CCRT failure receives high dose of CDDP, that means nothing but cisplatin and or other drug combinations. However, GOG 169 study reported that even though using the high dose of cisplatin and its combination, there is no improvement in overall survival rate and increased side effects. Hence, new therapeutic strategies are required to address these medically unmet needs in the cervical cancer. There where we are targeting, like our siRNA can able to it may not be the replacement therapy, but our siRNA can sensitize the currently available radio and CCRT methods. So how we develop this siRNA? We basically do the library, siRNA library. From that, we select the highly potent siRNA candidate. Then we check its we do library screening and lead discovery, followed by lead validation. Once we confirm its silencing efficiency, then we go for chemical modification and confirm its silencing efficiency again after doing the chemical modification. Again, once we confirm the chemical modification from the library, we again pick any one to three siRNA candidates for the treatment. With the siRNA candidate, then we go for a formulation by using different drug delivery system. As I mentioned before, so far I have used lipid nanoparticles and as well polymer-based nanoparticles for my siRNA and performed several in vitro and in vivo studies. So once we develop and once we confirm its silencing efficiency, once you develop the siRNA nanoparticles, with that nanoparticles, we just make a GMP and GLP level formulation. Then you can go for preclinical and clinical studies. Yeah. So we from the lead siRNA from siRNA hit, we have conducted many researches and we checked our combination therapy, and we have proved our siRNA is effectively silencing this E6, E7 oncogene, which also restores P53 RBETF signaling in the HPV positive cancers. When we combine with the low dose of radio and chemotherapy, which causes apoptosis and senescence, anti-angiogenesis, cell cycle arrest in the cancer cell. And we have published many research articles to confirm our mechanism of action. So today, as I mentioned before, this siRNA is a single siRNA targeting both E6, E7 oncogene, and then which restores P53 and RBETF signaling in the cancer cell, which way we are achieving the treatment of cervical cancer. So in order to confirm again, I just used one of the luciferase system, and here I'm going to discuss some of the dynamic model I have used and confirmed in the live cell. How this E6, once we silence this E6, E7 oncogene in a live cell, how it control the cell fate. So this the recent paper I have published is effect of E67 siRNA with chemotherapeutic agents on the regulation of P53 ETF dynamic behavior for cell fate decisions. So in order to confirm that, I just checked how this siRNA affects the P53 RBETF signaling in two different cell lines. Here I choose an HeLa cell for HPV 18 type and Koski for HPV 16 type. So I forget to mention that we have developed siRNA for both the types so that we can treat only HPV 16 type siRNA for HPV 16 type associated diseases. We can also use HPV 16 and 18 type siRNA for HPV 16 and 18 type associated diseases, which means cervical we have developed siRNA for both cervical cancer and head and neck cancer. Then single siRNA can be used for both both cervical cancer and head and neck cancer. In a broad way, in a broad sense, I can say HPV associated diseases. So I checked. If you see here, when we use cisplatin in combination of SP is nothing but siRNA pool, is a pooling of siRNA, is a mixture of 3 or 2 siRNA. So we selected 3 different candidates, potent candidates from our screening. Then we did the chemical modification with that selected candidate. We made a mixture of siRNA for the effective treatment. So we used pool of siRNA and we did a combination with the cisplatin. And if you see when we do the combination therapy, the P53 restorations happen in a high level of P53, and as well we can effectively downregulate ETF mechanism. And we have also performed many we have performed Western blot analysis to confirm the P53 and its downstream target. And here, if you see, I have checked P53 is maybe many of you knew P53 is a guardian of genome. So once we restore the P53 in when we restore the wild type P53 in cancer, so that we can change into the we can achieve the treatment. So here I didn't I also checked the active form of P53, which is here I have mentioned POSPO P53 and its downstream target gene P21. These are all the protein which plays a major role in cell cycle arrest and apoptosis. So once we restore these proteins in the cancer cell, which causes apoptosis and cell cycle arrest in the cancer. On the other hand, this E7, when we silence E7, which also restores RB protein, RB plays a major role by when this RB free RB it binds with ETF. RB binds to ETF and stop it promoting DNA replication and cell division. When we restore, when this E7 oncogene degrades the RB, there are many free ETFs are available, which causes uncontrolled cell division. So what we have developed, and with the developed siRNA, we have checked the all downstream mechanism of this both P53 and RB ETF signaling. We also checked the number of P53 downstream target gene in the mRNA level. If you see, when we treat siRNA alone and or in combination with the cisplatin therapy, we can restore not only P53, we can also restore all of its well-known downstream target gene of P53 in both HeLa and cancer Kasky cells. Here I have shown a representative image of HeLa cell. If you want more detail, you can refer the article which I have published in the year of 2017, I remember. Yeah. So why this P53 dynamics plays a major role. Um, Next, I investigated this synergistic effect of E67 specific siRNA on the P53 ETF dynamic behavior. Recently, several reports reveals that depending on the type and severity of DNA damage, P53 pathway activates either cell cycle arrest and or apoptosis. For an example, in the case of single therapy, P53 protein shows pulse form. Just like if you see, it's like a pulse form. That means in a certain time point, it shows higher and lower expression frequently, so that we named it pulse form. So if with the single therapy, we achieve a pulse form, but when we go with the combination therapy, we can achieve the sustained form of P53. When we achieve P53 in a sustained manner in the cell, which leads to irreparable cell death of cancer cells. So with the concept now, in order to confirm this concept, I have established P53 reporter cell. Maybe some of you may be maybe not aware of this, but this is a simple model. When we wants to do live analysis of any target protein, what we do, we just simply make a stable cell line model. That means if in your cell, when the P53 levels are high, this P53 will bind to its response element, which leads to GFP is nothing but green fluorescence protein. So when the P53 expressions are higher in the cell, so that when the P53 binds with this response element, which reports in a green fluorescence protein. I can show in the next few slides. I'm going to show how it works, but during my doctoral study, I have developed this stable cell line model, not only in HeLa, simultaneously in Kasky cell line model. So what we have to do, we just design the lentiviral vector, then we transfect into cell by using many transfection reagents. Simply, you can use any DNA transfection reagents for the transfection. Once we transfect, then you have to go for systematic a period of time for the establishment of a stable cell line. So once we develop this stable cell line, which allow us to analyze the endogenous P53 restoration timing in live cells. So what I have done, once I established the stable cell line, again I have treated both this siRNA and siRNA alone and or in combination with the cisplatin. So if you see, this is cell proliferation. So once I treat siRNA alone, when compared with the siRNA alone, when I treat with the combination of chemotherapeutic agent, we can achieve dramatic cell proliferation inhibition. So on the other hand, if you see in your right panel, the P53 count of individual cells are rapidly growing in a time dependent manner. So which means when the P53 levels are high in the cancer cell, which able to so that we can able to achieve more number of apoptosis in cervical in cancer cells. So I have used one of the live imaging system. We used the live imaging system named IncuSite. We have the system. What we do, we just after the treatment in any 6 well or any type of well you want to use, you just seed the cell and then go for the treatment, so that every depends upon how frequent you wants to capture the image, which will the instrument which helps you to capture the image in a certain period of time, so that you can check which time on what day when this P53 or whatever the thing you wants to check, you can do by using this live imaging system. So what I want to say here, when I did this single siRNA therapy and combination therapy, maybe I think you can see the timings. When I do single therapy in a very first day after the treatment, like after 17 hours, the cells are started showing GFP signal, which means there are the siRNA works effectively to degrade E6 oncogene, which helps to restore P53 protein in the cell. This once the P53 is restored, most of the cells are behave like a normal cell, which leads to cell death. But when I do the combination therapy, you can see here, like within like 88 hours, the P53 levels are, the GFP signal started showing, and within 1 day, most of the cells are enter into the apoptosis. So here I just want to show some of my video clip how it works. So what I did, like after the treatment, I captured the image with the help of IncuSite for every 1 hour interval, and I checked for like another, I think I remember like 4 days. So, but here I have not shown all the 4 days. I have shown like a very early stage how this after the treatment, like how long it generally takes. And you can see in the cisplatin treatment, like after 1 day or within a 2 day, you can see the GFP signal. The cells are started showing GFP signal. That means the P53 restores. But when you see this siRNA treatment, most of the cells are showing, but not all the cells are entering into the apoptosis. But whereas in the combination therapy, when we observed the most of the cell, those who are started showing the GFP signal enter into the apoptosis. So I just from my results, I just made a schematic diagram of my experiment. So when I do the single therapy of cisplatin, causes intra and interstrand DNA crosslink that induces P53 activation in a pulse form. When I use a single siRNA therapy, which restores P53 by silencing E6 oncogene, but not all the cells are not entering into the apoptosis. But when we go for a combination therapy of this E6, E7 siRNA with cisplatin treatment, the high level of P53 was achieved, and we also achieved the irreparable cell death in cancer cells. Next, since I confirmed one pathway in the human papilloma virus, I also wants to confirm the another mechanism, which is E7, because my siRNA is targeting both this E7, E6 and E7. Now I have confirmed like how from after the siRNA treatment, like how long generally it takes to silence the E6 oncogene and restores the P53 tumor suppressor signaling pathway in the cancer cell. Now, on the other hand, I want to check E2F also. So before that, I did some bioinformatic analysis. Maybe some of you know E2F is not a single protein, is the family. So E2F 1 to 5, I have checked in a different patients, and if most of the cervical cancer patients shows higher expression of amplification of E2F regulations. So what I have done, I with the established P53 reporter cell line, next I established a dual model so that I can check both this E2F and E2F RB signaling and P53 signaling in a single cell. So with the established P53 reporter cell line, then I have designed the E2F reporter lentiviral vector, and I have transfected with the same GFP, transfected into GFP reporter cell line. Then I have used a different selection marker for the establishment of dual reporter stable cell line. So in this HPV mediated cervical cell line, as I mentioned before, from the bioinformatic analysis, in general, most of the cervical cancer cells are showing high level of free ETF due to loss of RB protein function. So this ETF promotes a DNA replication and cell division that leads to tumor growth. So next, with the established model, now I want to confirm like in a normal without siRNA treatment, generally because of this E2F levels are high, these cells are showing RFP signaling. When I treat this dual reporter cell line with my siRNA, and these RFP signalings are when we silence these E7, which leads to restore RB-ETF signaling in the cancer cell line, so that gradually the RFP signaling decreasing gradually, and also since my siRNA is dual targeted, simultaneously I can see the P53 signaling through GFP reporter activity. So if you see here, based on my P53 dynamics in single cell level, if you see in a normal state, because of the free ETF level, most of the cells are showing RFP expression. But when I treat my siRNA in the dual stable cell line with the dual reporter, with the time period of time, this E6 E7 silences both E6 E7 siRNA silences this both E6 E7 oncogene, so that we can restore both the mechanism in cancer cells. So if you see maybe if you see, you can easily see here when the RFP signals goes down, and also on the other hand, when the GFP signal starts to appear, the most of the cells are entering into the cell death. That means which leads to cell death. So I have confirmed this in a dynamic way in a periodic time. So I have and also made a with the help of live confocal microscopy, I've confirmed this, and with the single therapy, the downregulation of ATF and upregulation of P53 were overlapped at a minimum of 22 hours. But when I go for a combination therapy, this P53 restoration happens in a very early time, in the at 12 to 14 hours, which means the fluctuation of ETF RFP expression level was observed in siRNA treated cells, whereas this ETF RFP expressions was steadily decreased in a combination treated cell. The induced P53 and its downstream target gene P21 may play a role in the inhibition of ETF. Next, what I have done, since my another hypothesis is like when we use this siRNA with the low dose of chemotherapeutic agent, we can still achieve we can limit the toxicity and also achieve the high effective treatment strategy. So what I did, I've used a triple combination. This cisplatin and paclitaxel is the well-known model for cervical cancer. So I have used the low dose of cisplatin and low dose of paclitaxel in combination with my developed siRNA. And I checked all the downstream regulation by using Western blot analysis. The same P53 reporter cell line. I've used the same P53 reporter cell line to check the triple combination efficiency, and I confirm that this low dose of triple combination strongly inhibits cell proliferation by increasing the P53 at very early level. Then I also confirmed the inhibition efficiency, how this triple combination effectively induce the cell cycle arrest at G1 and G2M phase, and also I confirmed with apoptosis. So if you see here, maybe with this one figure, I think you can understand very clearly when we treat a single siRNA therapy, we can achieve somehow this G1 phase cell cycle arrest at G1 phase. But when we go for a combination of cisplatin or low dose of cisplatin and paclitaxel, we can achieve more cell cycle arrest at sub G1 phase and the G0 phase, which means the increase of sub G1 phase is also means to which also we can say the more number of apoptosis cells in the treated groups. With all my results, I have later on I have established my siRNA in cationic liposomes for delivery, because most of the in vitro study you can simply use siRNA transfection reagent, but there are some commercially available siRNA transfection models are available, but based on my experience, some of them are shown high toxicity. Because of that, then I went and collaborate with the other laboratory for the development of siRNA cationic liposomes, and I conducted the in vivo experiment. I also conducted some polymer-based results. Because of the confidential issue, I cannot show here, since this live webinar is since it's streaming in a YouTube as well. So I think I cannot show because of the confidential issue, but what I want to say, with the developed siRNA, lipid nanoparticle polymer based, and as well this cationic liposome, we achieved high rate of tumor growth inhibition. And when we do immunohistochemistry analysis, we saw that this single therapy of SAR, when compared to single therapy of siRNA or chemo combination of chemotherapy, when we go for triple combination, we achieve more. That means it shows increased P53 RB protein expression, and as well tunnel positive, which is one of the marker for apoptosis. So this all increases because of due to the restoration of P53 RB UTF signaling in the cancer cells. So from all my results, I want to summarize here, like this triple combination of if you see here, the single siRNA therapy on one side it silences E6 oncogene, on the other side it silences E7 oncogene, so that silencing of E6 oncogene leads to restoration of P53 and its downstream signaling. P53 restoration also causes RB-ETF signaling in cervical cancer, which causes through which we achieve cell cycle arrest, apoptosis, and senescence. So firstly, the siRNA E67 siRNA prevents the proteasomal degradation of P53 RB-ETF signaling by inhibiting E67 oncogene. Second, the cisplatin treatment results in P53 activation of DNA damage dependent mechanism. And third, with the paclitaxel treatment, we induce P53 activation by independent of DNA damage P53. So with the three different mechanism, I think because of the three different mechanism, we achieve P53 activation in a cancer cell, which causes the apoptosis and cell cycle arrest. Again, it's again summary. It's like through these three triple combination, we achieve the maximal stabilization of P53 RB-ETF signaling and its multiple downstream target genes, have a crucial role in cell fate determination. And also this when we use triple combination with the low concentration of individual drugs, which also helps to reduce the toxicity caused by high dose usage of individual agents. Finally, these 2-in-1 E67 siRNA candidates have a therapeutic potential as radio chemosensitizer for not only cervical carcinoma, which also we can use for all HPV associated cancer. So as I mentioned before, we have conducted many research for the development of siRNA, and periodically we published a paper. Now we also doing GMP manufacturing of our siRNA and doing the formulation parallelly, so that probably by this by this year end or next year, early of next year, we are planning to enter our preclinical study, followed by IND filing, and then probably later next year we would like to go for phase 1 studies. So for this to conduct the apart from this in vitro in vivo study, what are all the things you need to prepare for the clinical study? You have to establish a specific PK analysis model for your siRNA therapeutics, and also you have to establish a model for pharmacodynamic maybe all you, since you are all a pharma students, you all knew what is PK and PD analysis, so I don't want to go in deep. So we have established specific methods for both this PK PD analysis, and also with the maximum tolerated dose and dose range finding study, we would like to finalize the treatment dose for clinical study. So I hope that with the less toxicity, we would like to go for IND filing in US next year. So probably from my presentation, you may understand like how this siRNA therapeutics can used for virus-mediated disease. The point is this siRNA therapeutics, you can go for virus-mediated diseases because most of the virus develops their own it develops their own gene, what I can say, it encodes its own gene in the host. So if we are targeting the viral genome, it's because since the siRNA therapeutics are more specific to the target complementary mRNA, so we are going to target only the viral mRNA, not the host mRNA, so that we can achieve a better therapeutic strategy without any immunogenicity or any other toxic common toxicity effect. Maybe this is like you all knew, like from the last December 2019, we are all facing this lockdown period, and that's why we are now, I'm also in front of you in the live webinar. Most of you are aware of all the situations, so I don't want to go in detail. So this siRNA based treatment can provide the effective solution in combating COVID-19 by targeting the sequence which coded for the viral DNA dependent RNA polymerase. That means polymerase, helicase, proteolytic enzymes, and etc. So we are going to target only the viral genome so that it will not going to affect any host mRNA. Since coronavirus are positive single-strand RNA virus that uses ORF 1 alpha and ORF 1 beta replicase to translate a single large polyprotein by ribosomes through frame shift event. This ORF 1A compromises two viral cysteine protease named papain-like protease and chymotrypsin-like proteases. Currently, these two protease has been considered as a major drug target for multiple antiviral agents, which are presently undergoing clinical trials. So RNA interference, siRNA, could be an efficient approach to control the virus by silencing the viral mRNA at particular stage in human cells. Complementary strands of appropriate mRNA will then get degraded using the special enzymes. Therefore, the siRNA drugs can play a crucial role in regulating viral infection and replications. Now, maybe many of the big pharma companies are competing each other for the development of vaccine. Here, I just want to show some of the recent report. This Alnylam, one of the leading siRNA therapeutic drug development company, also joined a hand with Vir Biotechnology for the development of RNA therapeutics against coronavirus. And even in Korea here, there is a company name called Olix Pharmaceutics, which is also one of the lead siRNA drug developing company in Korea. They also announced for the development of COVID-19 therapy. And finally, this AstraZeneca, one of the well-known big pharma company, also recently shown interest and started developing siRNA therapeutics for many diseases by collaborating other companies. So with this, I would like to end my presentation, and I would like to acknowledge my professor. He's a mentor, Professor Young Ishin from Seoul National University, and all my lab members. So maybe some of you may wants to know like how I moved to Korea. I got a scholarship from NID, which is embassy through embassy invitation. There are many scholarships available. So with the scholarship, I moved here in the year of 2011. Then I studied 1 year language program, so that I know Korean language. After once I finished my language course, I just entered into my PhD, and I finished my PhD here. Now most of the time I'm mainly focusing on the for the development of siRNA therapeutics, because I'm planning for the phase studies. Thank you so much for having me here. And also, this is another one. Sorry to interrupt. This is the another one. With my curiosity, I just started another one very journal. It's if anyone wants to share your valuable research, I'm welcome you to all to submit your research paper. Thank you.
Thank you, Dr. Nirmal, for your valuable and wonderful presentations.
Yeah, it's a more complicated topic, so I don't know. Many of you.
No problem. No, actually, you explained in a very simple manner, and we got on a very positive comments from various participants in the Zoom meeting as well as in YouTube also. We are getting very most appreciations words from that our participants. And can you answer your screen? Stop sharing your screen.
Stop sharing. Okay, sure.
Yes.
Yeah. Yes.
Yes. So now, whoever is having any doubts, you can raise your hands. I will unmute you. You can ask your doubts to the speakers. So the first one, Jivita R. Jivita R. You can unmute yourself and you can talk. Jivita. Yes, you can ask your questions. Jivita. Yes, I think there is some disturbances, and we can go ahead with our next participants. Muthukumaran T.
Okay.
Muthukumaran.
Hello.
Hello.
Yes.
Hello, sir.
Hello, sir. Yeah.
How are you?
Yeah, good. You?
Fine, sir. Actually, the presentation is very nice.
Thank
I'm
you so
very
much.
informative regarding, because now the world is facing the pandemic condition because of the virus. So
Yeah.
that is, I think this is the right time for the right topic. We had the session, and my question is regarding during the pandemic conditions, what are the therapeutic potential still we need more to control the virus?
Actually, that's a good question. From my perspective, like you may not able to control the virus, you can prevent the viral infection. Once if you infected by virus, we can go with some as I mentioned, there are many viral drug treatments are available, but this coronavirus is a new strain, novel strain, so that many of them are like they are not confident like whether the currently available viral therapy, antiviral therapy shows like it has any beneficial. It's like a still in question. That's the reason many of the company they wants to develop a vaccine against this virus.
Okay, sir. Thank you. And one more question, and another doubt I'm having. The replication of virus, how to control and how to uh, detect the replication of virus, replication sites of virus.
If, for example, if you, it's like if more replication is nothing but like a more, you can say RNA, right? So
Right.
that's the thing. The quantification is, that's the way we are quantifying by using, you can simply start with the qPCR. If you
Oh,
have the sequence, if you have that, it's already known, it's already made available in the online, like PubMed. If you go PubMed, you can see the sequence, entire sequence, so that you can design a primer for the sequence so that you can do PCR. It's a very
okay.
simple technique, yeah.
Okay. Is this cost benefit or everyone we can do, or is there any specification for?
PCR is the one of the low cost. That's
Okay.
why many of the company they are still showing their interest, but yeah, can do.
Okay, so thank you for your valuable information.
Thank you.
Okay, so thank you.
Thank you. Have a nice day.
Thank you, sir. Thank you, sir.
Thank you, sir.
Yes, sir. Thank you, sir.
Now the next question. Yes, thank you. So the next is Dr. Ghanshyam Mahan Sawang.
Yes, sir.
You
Good
can
morning.
ask your doubt, sir.
Sir,
Yes, good morning, sir. You can ask your doubt, sir.
it is very nice session. Every new information we got regarding the virus. So my question is that, is there any classification of COVID-19 according to their protein or their sequence according to the country where they spread? Means for India, in China, Wuhan, in America. So is there
Actually,
any information?
yeah, actually this SARS-CoV is already well. It's a, what I can say. It's a known virus, but the current one is the new strain. There is some sequence differences, and also I think China, from the Wuhan hospital, they already given the information about the entire sequence. So that's how it differ. Like everyone now, even in Korea, they were saying like it's not what is that? The previous one. This is another strain. The new strain is nothing but like there is some sequence difference from the original one. Obviously, there may be some mutations are happening, but yeah, I don't think they are classified right now, but there are many new strains already reported.
Are they becoming more dangerous?
It's maybe, I don't know. So far, even today morning also, I heard that what is the infection rate of this new strain. They mentioned like 1% can infect 1.2 people. That means one person can infect another one person. That's a thing. But it's not about dangerous. It's about like the infected person's immune response. If he has a effective immune response immunity, he can withstand the viral infection. If has any yeah, prior any kind of problem, probably he has facing some more issue. That I think that's what I heard. It's a age, because of the age and then their previous history, illness history, yeah, that causes more vulnerable.
Sir, my next question is,
Yeah.
your country, South Korea had a very good in this treatment of virus. And in India, if you see, there are number of increasing and mortality rate also going to be increased. So will you please help me some guideline regarding that? What treatment you are given to your patient exactly? In which drugs you are?
Actually, if you ask me very frankly, I don't know what kind of treatment they are taking. Actually, Korea is more focusing on how we can prevent further contamination. So if someone got infection through their GPS system, you know, they are giving a text message like, okay, someone got a COVID-19 positive here, so better you don't go near to any near the places. They are not only giving like the single street or single um, district. They are giving the entire area. They are giving the text message for even today morning also I got some message. So it's like they are making people aware better not to go to the site where the infected people are, they have found, yeah. And
Yes, sir.
they are taking the history, like where from how, and they are going back and checking the history,
Sir,
like where he went,
is
some, yeah.
is
Sorry, go
remedy
ahead.
having good results?
I
Thank you,
couldn't
sir.
hear.
Remedies,
I cannot hear you.
is remdesivir is having good result?
It's like how we are preventing. If you are preventing, prevention is better than cure, right? So that's the Korean strategy.
Thank you, sir. Thank you for your information. Thanks a lot.
Thank you.
Thank you, sir. Now the next question from Pratibha. You can unmute yourself and you can talk. Pratibha.
Yes. Hi, sir. Good morning, sir.
Hi, Pratipa. How are you?
Fine, sir. How are you, sir?
Yeah, good.
Yes, sir. Very nice presentation, sir,
Thank
regarding this siRNA. And
Mhm.
we are very to listen the siRNA. And
Mhm.
previously, we have know some of the recombinant proteins that are mentioned during the like cancers,
Mhm.
very common across in India, like L-asparginase. It's a recombinant protein where we are going for using for the cancer, sir. And
Mhm.
so the thing is nothing but the morning itself, I listened that the siRNA molecule, whatever that is there, it's mainly targeting the viral genome and
Mhm.
effectively working as an anti-cancer drug,
Mhm.
especially with respect whatever the presentation that have been presented there.
Mhm.
And so I'm having one doubt that whether the recombinant proteins, whatever the proteins that now right now we are using for cancer, I came to know that by listening of your session that siRNA is a more potent when comparing with its recombinant proteins. Why? Because
Uh,
the targeting of the gene of whatever the viral genome that is there, it is more effective with respect to that of siRNA and comparing with that of like recombinant molecules like proteins like elasticity.
yeah, somehow because of the voice interruption, somehow I understand your question. But if you ask me, that you cannot compare until unless if you have any of your molecule, and if you perform parallelly the experiments, you cannot say which is better, which is potential, which is more potent. But you can say that siRNA, with the siRNA we can specifically target um, the gene, the target gene, um, so that we can effectively silence the, we can downregulate the protein. But yeah, it's like you cannot simply, until unless if you have both the drug in your hand, and if you can, if you are performing the experiment, you cannot say which is more potent, which is, yeah, you cannot say that way. We cannot say that way, yeah.
What I mean to say is that
But
whatever
one
the targets that
thing,
we are
sorry to interrupt. One thing is siRNA, from the manufacturing and then for the formulation, everything is only expertise can do, and moreover, siRNAs are highly cost it's a it's cost effective. So with the
protein.
yeah.
What I mean to say is that whatever the
I
targets.
cannot hear you. Sorry.
Wait, so whatever the hello.
Yes, tell me, madam.
So whatever the targets that that viral genome, whatever that it is going to be having, the target specific mechanisms are most of them are having more mechanisms, like apoptosis is there. Several mechanisms that we are saying, okay. So that I'm asking the question, like siRNA, whatever that is there here in elastomeric method, we are saying an enzyme is going to be suppressed. So thereby, whatever the cell death is going to be occurring like that, I'm asking the thing. So whatever.
I'm so sorry. Actually, I cannot hear you I cannot hear you properly.
Okay, sir.
Your voice is breaking. If you do one thing, you can get my email ID, or you can see my paper, so that you can write an email. So I will respond you.
Okay, sir. Okay, sir. And one more question, sir.
Thank you.
Right now we are going. Hello, sir.
Yeah,
Hello,
yeah.
sir.
Go ahead. Yeah, go ahead.
Your voice is not clear, madam.
Yeah.
Your voice is breaking. Please use your microphone, the headphones you can use, and you can.
I'm using headphones
Yeah.
only.
Yeah.
Yes, I think due to your internet problems, you are not getting your voice clearly.
Right now, sir.
Otherwise, you can keep your questions in a chat box, madam. We will ask.
Okay, sir. Okay, sir.
Okay.
Okay, sir.
Sorry. Take care. Bye bye.
Sir, bye.
So the next, I think there is no name. Galaxy A50.
Okay. So how can I call Galaxy A50?
Yes, I think they are not.
There are many videos during the presentation. I cannot concentrate.
Yes.
I don't know.
Please, you can unmute yourself and you can type Galaxy A50.
Yeah, go ahead.
Yes. So I think they are not responding. And we can go over with the next candidate, Kirti.
Hello, sir. Good morning.
Yes, good morning, madam.
How are you, sir?
Good, good. You?
Yeah, fine, sir. I have one question regarding that COVID-19. Is it really life-threatening?
How I know? Actually, it's obviously life-threatening. That's why the WHO issued a pandemic. They confirmed it's a pandemic. So obviously it's life-threatening. I don't know. Recently, I think yesterday or day before yesterday, even those who got infected at the age of 21, he died. Something like that. It's I don't know. If you ask me, I seriously.
And again, that many of the in papers articles are coming that hydroxychloroquine and some of the anti-malarial drugs are also used to treat the COVID-19. What such mechanism involved in that COVID-19, sir? How it affects?
Frankly, Trump also mentioned this, and there are many clinical trials are going on. Frankly, if you ask me, if you check, because of this presentation, even I went through and I checked chloroquine and many anti-malarial drugs. They are
And paracetamol also is analgesic and analgesic, not anti that one, antipyretic,
yeah.
sir.
Yeah.
But the COVID-19 is not regarding fever, no, sir.
It may be this way. It's not like for the treatment. It's like when someone got a viral infection, obviously not all, but most of them, they got fever, right? Maybe for that reason they may use paracetamol, but I don't think it's for the treatment of virus. Sorry, it's to treat the virus. Yeah.
Okay, sir. Thank you, sir.
Thank you.
Yes, thank you, madam. Next candidate, Madhavan Madhu.
Yeah, I know him. Hi, Madhu.
Yes, you can unmute yourself, Madhavan Madhu. Madhavan Madhu, you can unmute yourself and you can talk.
I'm excited to talk with you after a long time, Madhu.
I think he's not connecting. He's not responding.
I think it's like maybe decades.
Yes, I think he's not responding. We can go on with the questions which they are posted in YouTube also.
Okay.
So the questions. Mr. Pandey, he asked, sir, can we use this therapy to malignant tumor also?
For what type of tumor? That matters, right? So, for example, if you ask me, many of the cancer causes in a different path, different mechanism. Some of them, it's like because of the mutation of tumor suppressor genes that leads to cancer. For this case, it's human papilloma virus is the virus-mediated cancer diseases, associated cancer. For this case, you can treat, but if you have the target sequence and if you are specifically targeting, you can do.
So now, just somebody is asking, I think, Vignesh. Mr. Vignesh.
Sir, good morning, sir.
Good morning.
Good morning.
How are you?
Sir, which genetic material used for coronavirus, sir?
Genetic material? I don't think so. Why?
Sir?
I didn't get your question properly. What genetic material?
Sir, RNA virus, sir. RNA virus, which RNA virus is involved in coronavirus, sir?
Okay, maybe you may see my slides. I have mentioned that is SARS, COVID-19, right? That's what you are asking. Which virus causes the corona, right? I think your question. I think yeah.
I think he's asking about that which siRNA is involved in corona.
Oh, really? He didn't say anything siRNA. He asked what virus causing coronavirus. That's what his question, right?
No, actually, this thing is asking. Actually, what is siRNA in that corona?
Actually, there are some articles already published. They have screened many siRNA. They made a siRNA library and they checked for COVID-19. That's why I just short summary. I just put in my slides. We can target that ORF1 alpha, ORF1b. So siRNA targeting these two proteins, with that we can achieve, yeah.
Sir, another question, sir.
Mm-hmm.
Sir, another question.
Yes, tell me.
Yeah, go ahead. Yeah, go ahead. Yeah, go ahead.
Sir, hydrochloroquine இருக்குதுங்க சார்.
Yes, yes.
சார் அது வந்து எப்படி சார் அதோட மெட்டபாலிசம் என்ன சார்? அது என்னத்துக்கு இப்ப கியூர் பண்றதுக்கு இப்ப என்னத்துக்கு கொடுக்குறாங்க சார்?
It's okay, fine, don't worry. If you it's see, generally most of them they wants to treat this virus, since they don't have a targeted therapy, so they wants to use the available antiviral drugs. Okay, so that's the concept. Probably that way they are checking, but I don't think why they were using, but still they are checking their efficacy of this hydroxychloroquine against COVID. I think which is under clinical trial, So once the results comes out, I can tell you something about that.
Thank you, sir, for your valuable answers.
Thank you, sir.
And that another question is from Urvesh Sagalesia. Can we use siRNA treatment for plant viruses?
Yeah, obviously. It starts from plant, so obviously you can do.
And another one question from Ilangovan Ponnilavasan. What is the advantage of siRNA over other antisense molecules?
Actually, siRNA, if you ask me very frankly, there are many antisense oligonucleotides named ASO. siRNA, it's a double strand siRNA. You are going in a dicer mechanism. If you are not using the dicer mechanism, you can go with antisense oligonucleotide. That's the thing. Yeah, simple. If you want to use natural way of mechanism, you can go with siRNA, or else. And when compared to antisense, until unless it's chemically modified, siRNAs are, I think, more stable. Yeah.
Thank you, sir. Another question from Gaurav Agarwal. Have you synthesized nanoparticles through chemical or green synthesis?
Chemical. We do by chemical synthesis. And many company now it's available. So yeah.
Yes, thank you, sir. I think there are so many questions also in the YouTube as well as in the chat box, and we will, because of that time limit, so we will now conclude that session, and we will send you these questions through your mail, sir. And we can, if you are giving an answers, we will send that answer to one particular persons through a mail.
Sure.
Thank you. Thank you, sir, for your valuable and wonderful session, as well as for whatever the questions which was raised from our participants for answer. So now I am requesting our principal, sir, to conclude these sessions. Principal, sir. Sir, you can unmute yourself, sir. I was unmuted. Principal, sir. Principal, sir. So I think there is some problems
okay.
Till that principals are joining. And Dr. Nirmal, you can tell me about that. What were the opportunities which was available in that Korea for pharmacists? So that may be very useful for our young pharmacists and young teachers who are joining this meeting.
Yeah, if you ask me that way, the first thing is because of the language. Since
Sir, Sir, Nirmal, we can't be able to hear you, sir. Just, sir, you can unmute yourself, sir. Sir, you can unmute yourself and you can talk, sir.
Yeah, I did.
Yes, yes. Now.
Yeah. If you ask me, like I started my doctoral degree. Before that, I learned the Korean language, so I don't have any kind of difficulties of understanding the language. But the many of them, those who are coming from countries like India and other abroad foreign countries, the main issue here is the language. So without unless you don't know the language, it is very difficult uh, to find a job and as well to survive, because most of them, they don't speak English here. Even I lost my confidence after moving here, like. So that's a one big disadvantage. But more Koreans are very friendly and they are very helpful. If you want to do your PhD, just write an email to respective professors, so that they will, if there is a vacancy in their lab, sure they will respond to your email. Apart from personal contact, you can go with some scholarships, like Korean government scholarship, NIID scholarship. Even our Indian governments are organizing I think in a yearly basis, through which even I came here. I got a Korean government scholarship through embassy. So that means I went to Delhi for an interview. I got selected and I moved here. So there are many way you can reach Korea. But before coming Korea, if you know a little bit of Korean language background, it helps you a lot. But even if you're not, it's fine. You can ask, you can directly contact the professors, and you can come here through many scholarships.
Thank you, Nirmal. And other one more thing, maybe another things, in case of an financial wise, so the packages, how it will be in Koreans. So compared to India, we will get more salaries.
Yeah, compared to India, obviously their what is this income status, it's higher. So obviously you will get paid more, and then the cost wise, maybe, yeah, it's not highly, because I live in Seoul. It's a very expensive expensive city, in like one of the expensive city in the world. So if you go some south side, you can find better accommodation with the low cost. Yeah, it's cost effective, and as well tax also, I think, very less. Until unless if you're paying, you are getting more, I think you no need to pay much tax. Yeah.
So except these PhD opportunities, can we get that pharmacist, like that job opportunities is there for those who are completed only B pharmacy?
That's the reason I said in the initial, if you don't know the language, it is difficult.
Bluetooth disconnected. Bluetooth connecting. Please wait.
Once you don't know the language, it is difficult to survive. That means it's not possible to work as a pharmacist here.
So if we are learn that Korean language here in that India itself, so that may be useful.
Yeah. There are many Indians. Actually, I started the language from zero level, but I know many Indians, those who did their language course even in Delhi, Bangalore. There are many language course centers, so that you can learn. It helps you to get the scholarship in an easy way. That is the only advantage. And I think nowadays many of them watching Korean dramas, everything. So K-pop is highly, highly in demand.
Yes. Thank you, Nirmal. Principal sir. Principal sir.
Hello, Dr. Saravanan.
Yes, sir. Can we conclude the session, sir?
Yes, sir. Yes, sir. Yes. So thank you all the participants for patient listening, and I hope you had a good session with Dr. Nirmal Rajasekaran, and he had accepted our invitation without hesitation when we have invited for this session. The topic is one of the best one that we covered till now, because everyone total world is thinking of this pandemic situation with the virus. So with this webinar, we must have learned something technically also compared to the other sessions or other topics. So with this, Dr. Nirmal has given good insights. So we thank Dr. Nirmal Rajasekaran for accepting our invitation. And thank you, Dr. Nirmal Rajasekaran. Really, it was a good session. Hope all the participants must have enjoyed the session. So in future also, if we need any deep or any more technical oriented sessions, we will contact you. You please accept our invitation, and
Sure,
let us
sir.
continue our relation. And
Yeah,
all the
sure.
participants are participated encouragingly. It's not for the just like a time pass or just for the namesake they are attending. And the total almost 3,000 participants are also watching in the YouTube. So
Okay.
that shows the seminar, how the webinar, how it is presented. So you have done your job wonderfully. So hope we have also done the things. Platform has been provided with the support of our management. So thank you one and all for joining us. I thank wholeheartedly Dr. Nirmal for this wonderful session. Thank you, sir.
Thank you. Thank you,
So
sir. Thank you so much.
in this occasion, we would like to provide a e-certificate to appreciate your efforts in this webinar, and as a token of love and affection with you. So
Sure,
kindly
sir.
accept this saved e-certificate, and we'll continue our journey in a long way.
Thank you, sir.
Kindly accept our certificate, sir.
Thank you so much, sir.
Okay,
It's my
sir.
pleasure. Yeah. Thank you.
Thank you, one and all. So with this, I think we can conclude the session. So we'll come meet in the next session. Hope we'll have many more laurel peoples like Dr. Nirmal Rajasekaran, and he will be also among us. And any of the participants would like to have any clarification, we'll share his email ID and the contact details. You can contact him, so that we feel happy that our job is done. And we, MNR College of Pharmacy is one of the platform that is giving the opportunity to interact with such a eminence. Thank you all. Thank you, Dr. Nirmal, and all the
Thank you, sir.
organizing committee members. Thank
Yeah.
you.
Thank you. Have a nice day.
Thank you, sir. Dr. Saravanan, you can sign up, sir.
Yes, sir. Thank you, sir. Thank you, one and all, for your listening.
Yeah. Bye bye. Take care.
Yes, thank you.
Bye.
Thank you, sir.